Good morning, guys. Welcome to another week of non-clinical rotation for physical therapy as educators. Now, we will be focusing on the roles of physical therapists as educators in a clinical setting. But prior to that, let's talk about psychomotor skills first. The amount of attention given to teaching psychomotor skills in physical therapy education has waxed and waned over the decades. The issue was and continues to be what skills professional physical therapists need to learn versus what skills should be learned and performed by technical and ancillary personnel. An educator's philosophy of what constitutes a professional and technical skills plays a crucial role in the amount of emphasis placed on the teaching and learning of psychomotor skills. So before we're going to talk what psychomotor skills are, let us check on our objectives for today. So first, we have to understand the importance of learning psychomotor skills. Second is to apply the phases of learning psychomotor skills to teaching clinical laboratory skills. Discuss phases of learning psychomotor skills and its application, and discuss how to enhance demonstrations of clinical skills and teach more complex psychomotor skills. So, you might be asking, what is a psychomotor skill? So, psychomotor skills are the action-oriented and require neuromuscular coordination and promote patient healing and or comfort. So, the literature describes several models of how people learn to perform psychomotor skills. And we have here one model described by Gentile in 1972, which is still a classic in this field. And this model now describes stages that learners go through. So, actually, in here, Gentile divided this into two main stages, which are getting the idea of the movement, and the other one would be fixation and diversification. Within these two main phases or stages, there are several cognitive and behavioral patterns. Tignan natin ngayon, kung ano tong mga nilalaman ng bawat isang stage. Okay, so let's move on with our first stage, which is now getting the idea of the movement. So, of course, this is the first step or the initial step. Okay, and for us to be able to do that is to first have a goal. So, that is now the learner is confronted with a clear-cut need or problem. So, for example, you wanted to do some range of motion exercises to your patient or to your classmate, then you need to think, okay, on what would be your goal. Yan, And there are many stimuli that affect the learner and his or her environment at this point, and some of which now relate to the goal and some are not. So what are these stimuli? So these stimuli actually influence motor activity, and they are called now the regulatory stimuli, and they are those that we must attend to. Okay? In here, the learner must devote selective attention to these regulatory stimuli in order to form an effective plan of movements that will attain the goal. Ayan. So, pag sinabi po nating regulatory stimuli, ito po yung mga stimuli na maaaring makakaapekto po, doon po sa mismong gagawin nating skill. Ayan. So, learners often have difficulty now in determining which stimuli are relevant and which are not. In some cases of motions or skills, okay, the student must selectively attend to the necessary equipment, yung verbal, visual, or written instructions, yung positioning ng pasyente, yung nararamdaman ng pasyente like the anxiety, and also the need for privacy and so on. So, ang mga ito, tawag natin dyan regulatory stimuli. But there are also stimuli that must be tuned out, And these are irrelevant talk and noise in the environment. So, maraming maingay sa mga paligid. and yung mga unnecessary equipment, no? These are all stimuli that we must be tuning out. And of course, there could be some stimuli coming out from our own bodies as physical therapists, such as, let's say, nangangating ilong mo, no? So this is also one thing that we need to really focus on. And we call this now the non-regulatory stimuli. So that is why these non-regulatory stimuli now are those that do not influence the skill performance. And we include examples like color of the bed, color of the equipment, and so on. Okay? So, moving on. If the skill now to be learned is a closed skill, in here, the learner's task in sorting out stimuli is not too difficult. Bakit daw po? Kasi pag sinabi natin closed skill, it means that one in which environmental conditions and relevant stimuli remain stable throughout and passively across performances. So, ano mamang mga example po ng mga under ng closed skill? So, meron po tayong, kunwari po, yung hand washing, mga ganon, no? Gloving. So, these are under the closed skill. Bakit po under siya ng closed skill? It is because these skills are those that are being practiced in a laboratory, and since laboratory conditions are usually held constant, so walang pagbabago doon. Okay? So, ang ibig sabihin, kumbaga, tutok ka lang, no, doon sa skill performance without any interruptions coming from the environment. But when skills are performed in a clinical setting, most of them become open skills already. Bakit daw? It is because the skills here are taking place in a changing environment. And regulatory stimuli vary throughout the performance of the skill. So, anong mga examples natin? Let's say, for example, you are already an intern. Since internship is a part of, kagaya nyo ngayon, di ba? You're all interns right now. So, since internship is a part of learning, no, a part of PT education, and you are now practicing in a clinical setting like hospitals, clinics, okay? Most of these are open skills already, okay? And examples, no? Ano po ba yung mga examples natin? We have taking vital signs, for example, or doing range of motion to a patient. And this patient might have some anxiety, no? O kaya, you are doing it unto a child, okay? A pedya, no? So, pag nangyari yon, the child might talk, the child might cry, no? And move during the procedure. So, in this case, there could be more difficulty, okay? Bakit? Kasi there are a lot of environmental demands, no? And you have to meet these environmental demands. Ayan. So, since now, once the learner recognizes and attends to the necessary stimuli, okay, then you have to plan, okay? And we call this now a motor plan. So a motor plan is a general mental preconception of what movements will be required to attain the goal. So the learner then executes this motor plan with greater or lesser success, okay?